you reinventors. This is Lesley Jane Seymour, and I am the founder of CoveyClub and of this podcast. And I am so excited to bring to you somebody who is trying to reinvent healthcare for us. If you have had any encounters with the healthcare system, which I am sure you have by this age, it's tough. There are problems, there are fabulous things, and there are tough things. As you know, you have to be, and as I say, you have to be your own advocate when you get information that doesn't sound right, or you want a second opinion, or you want more research, or you want to find the expert in your field because whatever you're doing is not helping you. You have to be that person. And what I love is Gina Siddiqui, who is a physician and founder of and CEO of CART Clinics, is trying to do that for us, meaning that you can come to them with questions, with research needed, with second opinions. They are what do we want to call it? A concierge kind of research / actual doctor clinic, where they'll do the research for you. They'll put you in touch with the right people. As you'll hear from Gina, for some of her executive clients, they actually even take care of making sure they do their tests and they get the right help and on a yearly basis, all that. But all the way down to touching the public, they, take my example, for instance, when I had my breast cancer diagnosis and I didn't know where to start. And I'm a very educated person. I've written 1,000 stories about, or edited 1,000 stories about breast cancer. But when it happens to you, you're like, oh my God, now what do I do? Where do I start? And I honestly had to pull in a friend in the healthcare area to say, like, where do I start here? And the first starting was, of course, trying to find out where I should go and how to evaluate where I should go. That's the kind of thing that Gina can do for you. So not only is she a reinventor herself, she was an ER physician, she is, but she's starting this business on the side, which is good information for people who want to do, two businesses at the same time so they can launch themselves in a different way. But she's also trying to reinvent the whole medical system. So I welcome you to meet with Gina Siddiqui, and she has talked about her vision in the New York Times and Time, Scientific American Quartz, and she has collaborated with groups reimagining the experience of medical care from the American College of Emergency Physicians to the Rhode Island School of Design. So here she is. Welcome to the podcast, Gina. I'm so excited that you're doing this with us.
Me too. Good to see you, Lesley.
So let's talk about your personal reinvention first, just very quickly. Where did you grow up and how did you decide to go into medicine? Was that your first choice? Are you from a family of doctors?
Yeah, so actually not at all. No one in my family is a doctor. And being South Asian, there was a lot of expectation and hope that somebody in the family would become one. But I actually thought I was going to be a writer, which kind of turned out to be true too.
Okay.
In college, I went to different countries to study their health systems and how they were especially taking care of underserved populations. And when I went to interview, actually in Chile, this clinic that put together traditional healers and sort of modern Western medicine healers in the same roof, I just watched the most incredible moments of connection. Basically, people came from all over the country, from rural places, from the city, and these healers, they would meet these people, and in a few seconds, it would go from people from completely different walks of life who would otherwise, really never even, interact with each other, to having this very deep, sacred connection and trust. And I remember, observing this, thinking about how to write about this, and realizing with a lot of conviction that I didn't just want to watch it. I wanted to know how to do that. I wanted to know how to be so connected to somebody, from anywhere in the world, any walk of life, in an instant.
And that sent you to medical school?
Yeah, so I studied economics in college. I,
Okay.
like then took whatever the classes were and applied, and yeah, the
And what
rest
did
is
you study? Did you come out as a GP or were you a specialist or what? And where did you
yeah.
grow up? Were
So
you in New York or where were you? Were you
I
in the
grew up
US?
in the DC suburbs.
DC? Okay.
Yeah, in on the Virginia side, and very kind of a lot of first generation immigrants around where I grew up, and just a lot of people, I think, with so much optimism about the American dream, um, and a very common story, I think, of seeing how people here will give you a chance and take a
Right.
bet on you if you show that you're ready to work hard and be true.
And so what did you come out at? What's your degree in? Are you just
I'm
GP
an
or what?
emergency medicine doctor.
Oh, emergency medicine. Okay.
Yeah. So I went to med school at the University of Pennsylvania, and then I did my residency at Yale. And in Connecticut was very heads down on. I actually did residency during COVID, so it was kind of
Oh,
a
ouch.
crazy, intense
Wow.
time.
And you did
And
emergency room medicine during COVID? Holy
yeah,
moly.
yep. And then my first job out of residency was in New York, also during COVID,
Mm.
and when I was pregnant as well, and we sort of didn't
Oh
know
my
what was going to
God.
happen.
And you were okay through all that?
Yeah, yeah,
Oh,
thankfully.
okay. God bless. So then what is this new project you're working on? Because you are trying to reinvent the medical experience for the consumer.
Yeah, exactly. And I think I didn't really realize that if you want to reinvent a field, you have to do some work of reinventing yourself and thinking about how you're a part of that field to really get there. So, CART clinics is as you put it, a reinvention of the relationship that doctors have with patients. We basically set it up so that doctors can give a fresh set of eyes to people on any health questions that they have. We support our doctors with a team of nutritionists, personal trainers, therapists, care coordinators, really all the different experts that touch on health. And we try to make it so that our only objective is to align with the patient and understand what their needs are, kind of no other intervening incentives to distract from that.
And is it a concierge medicine? Do you pay into it? What happens? And is it virtual? Can anybody join?
Yeah, so it's a virtual practice, and we have made it so that we right size your question to the kind of amount of resources that it will take to answer it. But yes, it's cash pay.
And so what kind of things have you done and what kind of doctors do you have working with you? And what kind for the consumer, what have you are you launched already?
Yes, yeah, we're
Yeah.
live in all 50 states. So anyone anywhere in the United States can use this. And actually, the way we've set up our practice, it actually works for when you're traveling internationally as well.
And so if I'm a consumer, what's my story?
Yeah.
How do I reach you? What happens? What can I learn? What are the
Yeah,
different
so
levels? Because I know you're offering research as well.
absolutely. So people come to us with a range of medical questions or problems. The most common thing that happens is something has come up with your health. You know, you either have a symptom that you don't have an answer for, or you saw a doctor or specialist and they told you something that just doesn't sit right with you. It doesn't make sense. Or something really stressful is happening with your loved one. They just got out of the hospital or they just got a scary new diagnosis. And you want someone on your side who understands the medical system and who can advocate for you and get the right things done. So that's when CART Clinics comes in. You get in touch with us. The first touch point you have is with a doctor. That doctor has no other sort of biases or incentives where to send you or who to promote. Their only objective is to listen to you, your story, your medical history, and then your life, you as a person, what your profession is, how you think about risk and how much certainty you want in things, how you feel about invasive procedures. And then, like you said, we get to work. We do research. We talk to the relevant specialists in your field. We look through our directory of referrals that we've already made in that subject area, in your geography, if relevant. We have a directory of a lot of digital health tools and companies that we've vetted and done research on. And then we basically come up with a comprehensive plan for you.
So
And this,
yeah, go ahead.
I was just going to say that this can be one-off. It's like a problem that you have, and then we just resolve it for you, and then we part ways. We just stay in touch, only if you need us. And then something that's been increasingly common is you actually know that health is going to be a priority for you for the whole year, and you sign up for membership with us for the year. And then we're kind of your partner with you as you make, all those changes.
Can you, without giving names, can you give us an example of the different things that people actually worked with you on, that
Yeah.
so people can understand the levels and give us an idea of what those things
Totally.
cost?
Totally. So, on one side of kind of intensity or complexity, there we've had people with new cancer diagnoses or kind of mysterious new entities that were found on scans that feel life altering, that change a lot of the plans that they had for traveling, for time with their grandchildren, for if they were never on medication and now they were going to need to be on them. And we've basically, surveyed the literature and the medical community in that field to make sure that the advice and the guidance that they're getting is really the best in line with what they want to do. And then on
Ah,
the other side of the spectrum, executives who are really busy have gotten in touch with us to say, I know I want to be more on top of my health, but it's a huge pain for me to research online, which personal trainer to go to, which of these diets or supplements are snake oil and which are real. And I also just know I should make the time for these regular routine appointments, but I don't make them. So please be my advocate to do all of those things for me and make sure that I'm doing it, to a high level of quality and, in line with my goals.
so for the top line people, you kind of do it all for them. So you'll make them, give me an example of what that would be. So would you say to them, here's, find them the gym that they need to go to and the trainer they need to go to, like, just flesh it
Yeah,
out a little
absolutely.
more? And if,
Exactly. So we have in-house personal trainers who will audit, if they already have personal trainers, if they already have a workout routine, if they already have a gym that they go to, we'll sort of make sure that it is addressing some of the, work tendencies that they would have for biomechanical problems. Let's say they work at a desk all day, or let's say they had a chronic shoulder problem. We make sure that their regimen is fitting in line with correcting those goals. And yeah, if needed, we connect them with personal trainers, with therapists, with coaches. Um, if they want to get some more quantitative analyses, we connect them with the right facilities and the right tests that are, evidence-based versus sort of just, spending money on things that really don't give you any additional information. And yeah, we literally make appointments for them. And then for some of our clients who have family members who they want to focus on making their health better, we actually will attend those family members' appointments with the family member, help take notes, ask good questions, make sure that the whole family is aware of, kind of what the important items are and are prioritizing them appropriately.
is that virtually?
Hmm.
Ah, okay. So it's getting that doctor to do a virtual thing, but
Well, even if
pulling
it's
you
an
in.
in-person appointment, we just call in on the phone or virtually.
Oh, I see. I
Yeah.
get it. Okay.
Yeah.
And give me an idea. So give me an idea though, what these things cost and what the sort of scope of each thing is, because I want to get down to the part also that is more accessible to
Yeah.
everybody, which is the research, which I think is really interesting. So
Yeah.
start at the top with
Sure.
the guy or woman who's an executive and doesn't have time to do this for herself.
Yeah.
What you're giving, what they're getting, what it costs.
Yeah. So our executive clients, the price kind of depends on how in depth we are, but it can go up to the tens of thousands of dollars
Oh,
a year.
okay.
And then for people who want sort of a one-off opinion, it can be as cheap as $300, especially if we already have some of that research done, and we can just tell them, hey, this is a really good, endocrinologist for what you're looking for. This is a really good service that you can avail yourself of that should solve your problem. Or, I think one of the most important things that we do that makes me really proud as a doctor is sometimes the medical community actually gave you good advice, but it wasn't explained well. And you can be rightfully skeptical and want to make sure that it's not just a rushed conclusion that doesn't really fit your unique case. And sometimes we do the research and we we'll even talk one-on-one with the doctors who made the recommendations, and we'll come back to the client and say, you know what, actually, we think that this is the best advice for you, and this is why. And we make sure that all the questions were answered.
Ah, and you've had that experience before?
Yeah, definitely.
Now talk about the research part of it. So if I want to come in, so I'm just thinking of um, you get a diagnosis and you don't know what to do or where to start. Or somebody well, they'll take me. Somebody
Yeah.
found, they found, three different things in one breast. And then they said, oh, well, we'll get to that biopsy in 3 weeks. And I was like, oh my God, now what do I do? I had to summon my girlfriends who were in the business. Luckily, I was able to do that.
Yeah.
If people don't have access to that and don't have friends who are breast surgeons or don't have connections into other things, how would they get that help from you, and what would it provide, and what would something like that cost to get you to the right place?
Yeah. Well, I think that, first of all, thank you so much for you being so open and articulate about your own experience. I think all
Mm,
of us women have to do that because so many people have had the, you know, the frustration of going to a doctor and being told something and just knowing like this
doesn't
doesn't
sound
feel
right.
like all there is. And
Mm,
how can this be like they're just closing the door on me? The appointment is over. Like now what do I do? So, it actually a lot of the way Cart Clinics works was inspired by my experience of friends calling me exactly the way you described you calling your girlfriends.
ah,
So the way the conversation starts is really the same way it would be if you called a good friend. You would just say, I don't know what the heck is going on, and just describe the circumstances. We get, your medical records once you release those to us so we can also see how the doctor articulated it in their notes. And, we try to, at the beginning, basically make a good judgment call estimate for how many hours, how much time, which resources it will take. And then we just go from there. We say, okay, well, we think to, find you the right specialist or to be with you for the next couple of weeks as we process each of these different lesions that were noted on this imaging and then try to decide next steps. This is how much time we should all be together. This is the next time we should meet to sort of debrief on what to do with the new cycle of information. Because so much of medical decision making is like that now. It's like, well, right now we have an incomplete picture. In a few weeks, we're going to have this extra piece of information, and we have to talk again and figure out what to do with that information. And I think
right,
what people are so frustrated about in our medical system is that nobody has set aside the time within the system for that explaining, for that,
right,
extra layer of personal touch of, okay, for me, for my life, does this make sense? Or is this just a generic guideline?
right. Are you able to get into Epic and share Epic? Is that how you get
Yeah. Yeah.
people's stuff? The
Yeah. So
Epic is, just so we explain what Epic is. I'm sure most people are familiar, but just in case they're not.
yeah, absolutely. So Epic is one of the companies, the leading company that does electronic health records. So it's how you share records with your doctor. Sometimes it's how you would message your doctor with questions. It's where you get those annoying appointment reminders that you have to like log in to actually see what the appointment
Right.
is.
Hmm.
So yeah, it's really important for our team of doctors and other health professionals to be able to see your medical records. And we're very lucky that now there's ways to do that pretty seamlessly.
Are there other systems like that that you get into, or
Yeah,
okay,
exactly. So a lot of outpatient private practices that aren't affiliated with big health systems have other electronic health record companies that they use that are less expensive, basically. So yeah, we can do the same thing with them. And then if you share your, permission with a health professional to look up health records on your behalf, they can actually do the legwork to find the records wherever they exist, even if they're only in paper form somewhere.
so for someone like me, when I was like, oh, wait a minute, this doesn't sound right, like I should be waiting 3 weeks for this, what should I be doing? If I'd called you, what would have happened next? Would you have been able to, you would have been able to look at what the doctors had sent to me, right?
Exactly. We would review your results and we would get to know you a little bit and understand, what what was really important to you. Did you want answers within 3 weeks, less than 3 weeks, because you felt like waiting during that time period was going to cause you a lot of stress and anxiety? Or had you been told that there was a specific action that needed to be taken medically that would be really different if it was delayed by 3 weeks? And that helps us sort of know what are the most important outcomes that we need to advocate for you to do.
Uh-huh.
And then, just like when my friends would call me, most of the time, I'm not the expert on the thing they're calling about. So then what I have to do is I have to think, who is the expert? Who has the
Mm-hmm.
right answers for this question? So the, bulk of what we've done since we've launched this company is build a really robust directory of specialists and experts who we have on call for us. So we really lean on those people who have expertise in their domains. Medicine has become so specialized these days that they can then say, for this entity, for this type of procedure, for this type of patient, this is the leading center. This is the center of excellence, or this is the person who really knows the most about this, or this is the person who has a reputation for really caring enough to go the extra mile and get an answer. And
Mm.
then we try to basically get in touch with those people and make sure that our patient gets the right answer.
Interesting. Is there something that you can't do? Is there something you've been struggled with, or people should not come to you
Yeah.
for?
Yeah, absolutely. I think there are some individuals who want to cut the line, who want to sort of be treated like they're more important than everyone else. And that's really against, I would say, our team of physicians' code of ethics. We want to make sure that everybody has access to the best, highest quality care. But if somebody has something non-urgent, we're not going to call on your behalf to a center and tell, another patient who is deserving of that time, who has something more urgent, to move aside for you.
Interesting. Have people asked for that?
Yeah,
Yeah.
we can choose who are our clients and who are not our clients. So we're very lucky that everyone who we work with are we think patients who have the right perspective on their care and the care of the people around them in their community. And it makes it simple for us to always want to just advocate for them and not feel like there's anything they're pressuring us to do anything wrong.
What does cart clinics mean? I didn't understand that. I was like, does she mean like shopping cart? But
Yeah.
it's spelled differently. I was like, there's got to be a story where it means something.
Yeah, you're absolutely right. So carte means map in French.
Oh,
And
that cart. Okay.
yeah, exactly. And, like a la carte, like the table on a menu.
Ah, I get it. Okay.
Yeah, so the reason we're named ourselves after a map is because hospital, the origin of that word is actually the same as like a hospice or a hostel or hospitality, which is guest. And the traditional kind of like origination of hospitals was really to make people feel like guests, usually when they were on the path to dying. And if you're really sick, you kind of want the health system to be your overlord, like take the reins and be in charge. You're kind of like not in a position to make your own decisions anymore. So if the hospital was still only the place we went to when we were unconscious or, on death's doorstep, it would be fine to be treated like a guest. But we go to the hospital for routine preventative screenings. We go there for physical therapy. We go there for counseling. And it's not right when we're, in the prime of our lives and have a lot of agency to be treated like guests. We should be treated like owners of our own bodies. And the way that the medical system should treat us is that, hey, there's this really complex topography. There's all these specialties. There's all these different, types of thinking about healthcare. We're going to give you a map and you can choose where you want to go and we'll be your guides. You're in charge. You're not a guest here.
What do women do that's different than men in this situation? Have you seen a difference between how women handle healthcare and men?
Yeah, I mean, I don't want to paint broad strokes, but definitely I see a difference. In the ER, for example, I always see men coming in with their wives, and they say, "I wouldn't have been here except for my wife told me I had to go." And invariably, it was amazingly helpful that their wife told them to go. So people
That's
talk
why they
about
live longer. The statistics are
right.
married men live longer, women live shorter when they're married.
Right, right. I think that women, there's kind of a general understanding within like consumer goods and a lot of home decisions that women hold the checkbook, right? They make a lot of these decisions, and I think for health of a family, it's oftentimes the women who are helping choose some of the doctors, make some of the appointments, and are more proactive about this stuff. Unfortunately, kind of paradoxically, women are also, I think, treated a lot worse in the medical system. their symptoms are taken less seriously. I also see in the ER, basically, if a woman is screaming in pain and a man is screaming in pain, the man's screaming is going to be taken much more seriously. And the woman is more likely to sort of be, it's going to be thought that, okay, maybe it's psychiatric, or maybe she's overplaying it, or, things like this.
Wow, we're still seeing that today. That's amazing. What about in terms of race or color? Women of color, I know that apparently there's a pain issue there. People think women of color can handle pain better than other people. Do you see that as
Yeah,
well?
I think that hospital settings, the higher acuity, the more things that are people don't have time to sort of like gather data, and they're just making instinctual reactive decisions. People fall back on whatever stereotypes or exposure or past experiences they've had. So, I think the only way to fix this is to make medical staff representative of the communities that they serve, because then everybody has the same sort of background experience of like, oh, this person could be my mom or my dad, or I know I grew up with people who look and act similar to the way this patient is acting, or wear similar clothes, or medicine is a very intimate practice, who smell the same way. um so I think that's the only way to really fix that. But, in the interim, what you can try to do to correct those biases is you can just take a little bit of extra time, and give people the benefit of the doubt.
So what would you recommend for, CoveyClub deals with women 40 plus.
Yeah.
I mean, in terms of us taking more charge of our healthcare, which I highly advocate for. I mean, as I've told you and I've told the CoveyClub group, I got I had a clean mammogram. Everything was fine, except, oh, look, they can't see everything, but whatevs. And
Yeah.
I had a push to get a different service that then revealed it wasn't okay. What are your sort of overall recommendations in terms of your gut, in terms of how we should access and handle the healthcare system today?
Yeah. I think the first thing is to just know that you're not guaranteed fairness or thoroughness in our modern healthcare system. Just be aware of that. Even if there's no bias, even if you're the most privileged person and the doctor in front of you has the best of intentions and wants to serve you well, our medical system is just not set up in a way that you get thoroughness and good research and adequate assurance the first time you get an answer. So just go in with that level of skepticism. The second thing I would say is be especially aware that women's symptoms are, for example, symptoms related to menopause, symptoms related to hemorrhage, postpartum, symptoms related to endometriosis are poorly understood and are not incentivized by today's medical system to be treated, right? There's the status quo is these are things that people just should suffer through, and we don't have good answers for them. And we aren't pressured as a medical community, I can just speak, doctors like myself, to get to the bottom of them and fix them the same way we are, for example, for a blockage in somebody's coronary arteries. I think we're trying to change that, but I think that's the reality today. I hope we can record this podcast in a couple of years and say like, oh, wow, look how far we've gone. And then the third thing I would say is, equipped with that understanding, when you don't feel like you're sure what you heard is right, first, press a little bit more, be assertive. And then, after that, if that doctor or that medical center or that facility, just don't answer questions, you have to be ready to find other allies and look elsewhere. I think your health is too important to feel like, it's erasing you and, what your priorities are. I actually think it's one of the most empowering things a woman can do to feel like, oh, like I have taken the time to take care of myself. I have taken the time to protect my mental health. I've taken the time to make sure that I'm going to be here for the people I care about in the future. And, no one should get in the way of that.
So lastly, let's talk about reinventing either the doctors who are listening and saying, I want more than what's happening, or I don't like the system, or I want to figure out how to deliver better care, or for other people in, adjacent fields who may be thinking, how do I reinvent myself within this field of some sort?
Yeah.
How would they go about it? Like, what would you tell me as a girlfriend,
Yeah.
personally, like, this is what I had to do. I'm so glad I did it, or I shouldn't have done this.
Yeah.
What tips and tricks do you offer?
Yeah. Well, we should do a podcast where we interview you because I think you have a really good story about this. But yeah, I mean, that's actually my first piece of advice is, listen to podcasts and find articles and interviews of people who really inspire you, who you can see are living authentic to themselves. I think it really propels me forward to see examples of just strength. I love that quote, respect strength, not power, you know? I think the second thing that helped me take the leap was I had kind of like a little notebook of times that I was really inspired by patients or people, heroes in the healthcare system. And I tried to remember, hang on to those people who did things in difficult circumstances and not just like put them on a pedestal, but figure out what were the circumstances that made that happen, because sometimes it's like, oh, I was able to be really kind to this person because it was a quiet day at the ER and I had more time. It seems like being under constant time pressure makes it really hard to be a good doctor. So how can I create a system where there isn't a time pressure that's sort of opposed to doing the right thing? And then the third thing that I started doing in the hospital, even before I started this company, that was so liberating, is I just stopped caring as much what the people who were, theoretically my bosses wanted. And I started getting closer to my customer, the patient, the person who I'm trying, the whole business, the whole enterprise is theoretically supposed to serve. And the really, kind of subversive but satisfying thing that happened when I did that was, if you're doing the right thing for the patient, but it's against some hospital policy, they can come to you and they can complain, but then you say, I was just doing the right thing for the patient. They kind of have to retreat and realize that they're in the wrong. I see this in law. I see this in banking. I see this in so many industries where, as the frontline workers, we think that we don't have any power because, the boss, the machine is so, against the needs of the customer. But if you actually do the right thing, they really can't fire you for doing that.
That's so interesting. I didn't know that. And then, lastly, I've got a crazy question for you because we're
Oh,
almost
great.
done here. What do you do as a customer when this is what happens is you fall in love with your OBGYN, you fall in love with your surgeons. You do make them into gods. I mean, it does happen.
Yeah.
So, and that's one of the problems is then we get these people who think they're gods and they don't have to answer any of your questions.
Right.
But
Right.
it's this, like push and pull. It does happen. I remember when when my OB delivered my kids, I mean, I just thought he was a god. I mean,
Yeah.
honestly.
Yeah. No, totally. And actually, I think that's the same realization I had in my little notebook was I had this patient when I was a medical student who had cystic fibrosis and he was this super smart engineer and he was really hard on all of his doctors except for one. And he could tell me as kind of a confidant because I wasn't part of that kind of group what he thought about all of them. And he could sort of confide in me about, oh, I'm really not sure about what this person said. And I think that's really the only way you can kind of separate these really busy, preeminent people in their fields from kind of what they say is have like an outlet. It's kind of like the same advice we give like in marriages, right? Like, you can't complain to your spouse about everything. Sometimes you have to have another outlet, another person to talk to who is sort of unbiased and not in the soup. So that's really what Cart Clinics does is we're doctors. We understand all the medical stuff, but we have no skin in the game. We're not trying to ham someone up and we're not trying to, pull them down. We just want to do what's right for you.
Interesting. Well, that's a great place to end and wonderful, Gina. I'm so excited for you. The only last question, are you still an ER doctor,
Yeah.
but you are. So you do
Yeah.
this and that at the same
Yeah.
time?
Yeah, I do. Well, not at the same time. When I'm working in the ER, other people are covering for me for our patients, our clients.
Wow.
Yeah.
Oh, wow. Okay. So I didn't realize, I thought maybe you had left that behind. Wow.
No, I
Okay.
love, it's still great to be in the front lines.
Good for you, girlfriend. Well, awesome. And thank you so much. Where can people find Cart Clinics and where can they find you?
Yeah, so Cart Clinics has a website. It's just cartclinics.com, CARTE clinics.com. And we're on LinkedIn. I'm on Twitter. You can just search my name, Gina Siddiqui. And yeah, we love to talk to people and hear their stories.
Awesome. Thank you so much. I'm so grateful that you're doing this.
Thank you.
So I hope you enjoyed this conversation with Gina. I hope that you took away some inspiration about what you could do. Maybe you're in maybe you're a physician, maybe you are in the medical field, maybe you're a lawyer thinking, how can I do this similar thing for law? I think all these things are great food for thought for us. And if you need help, you know Gina is there. That's what's great as well. And if you are reinventing yourself and would like to connect yourself with a fabulous group of supportive women, come on over to CoveyClub.com. First of all, you can download hundreds of free things, guides, checklists, everything. And we will help you get your reinvention, rethink, reimagine, reboot started, whatever it is. And and that's all for free. But if you are really in the throes of it and really need some help, I urge you not to do it alone. I had to do it alone. It was way too hard. Come and join the club and we will help you do it. We have pods, we have challenges, we have all kinds of get-togethers, 1-day get-togethers, 3-day get-togethers, where we really work on what you're trying to do. So come on over to CoveyClub.com. And also don't forget to give us a review and leave us a comment. We would really appreciate that. And give us some stars on Apple Podcasts. That helps other people find us. So till next time.